What are the 5 hardest residency interview questions, and how might experts respond to some of them? That's what I'm going to do today. I'll give you a sample of 5 different questions and provide an expert answer to one, explaining my rationale behind it. First, hi, my name is Dr. Sarah Clape, and I'm an admissions expert with BeMo. So, there are any number of different kinds of questions that you can get in a residency interview, and I've talked about some of these kinds of questions in a slightly different context, which is largely in the MMI. The kinds of scenario type questions that we tend to associate with MMI absolutely can come up in a residency interview, so you want to make sure that you prepare for those. But today I want to talk about some questions that are a bit different than that, since we do have quite a lot of information on those already. So do check out our blog and our videos on YouTube so that you can see a lot more about those scenario type questions. So, one of the first questions that you're likely to get, which isn't really a question so much as just a request, is tell us about yourself, or tell me about yourself if it's a one-on-one, tell us if it's a panel. That is such a vague statement. Tell us about yourself. You could fill in the gaps with just about anything, which is what makes it so difficult. It's just like when you have to write a personal statement and they don't send you a prompt. It's just write a personal statement of this many words. And you're going, oh my God, what do I need to say? What do you want from me? Same thing with tell us about yourself. So a lot of people make the mistake of answering this question as just sort of a biography in terms of basically just reciting the things that are on the CV, and that's not what you want to do. They've seen the CV, they know, what your scores are, what your quantitative data is in terms of your grades and things like that. They've seen the work experience that you've had and all of that. So this is the time to draw on some of that, of course, but prioritize the points that you think are most important and use these to demonstrate the kinds of qualities that you have that make you suitable to enter this residency program. Right, so certainly concrete skills that you've developed so far, but also your ability to work with others, to work as a team, your reliability, your resilience, the way that you interact with peers and superiors, what kinds of values you see in the patient-physician relationship, those sorts of things. So you don't just want to give a chronological list of stuff you've done and places you've gone. You want to use this to focus on those personal qualities that you want to emphasize. And if you're not sure which qualities you want to look into, there are a few places that you can look. If you're in the United States, then of course there's the AAMC core competencies that list the competencies that are sought in future medical professionals. If you're in Canada, you can look at the CanMeds framework, which gives a number of different roles for future physicians, or physicians in general. And you can also look at the mission statement of the school. And I've talked about this before, but just for the sake of reiterating, looking into the mission, vision, and values of the school or program that you are trying to get into is a great way of identifying what they're also looking for in candidates, because they want to see that their candidates and residents, future graduates, etc., maintain the mission, vision, and values of the school. So, second difficult question, why should we choose you among all of our other highly qualified candidates? So this is a question about your characteristics at a personal level and at a professional level, but also a question implicitly trying to see what kind of approach you take in terms of comparatively evaluating yourself against others. Which is to say, do you come off as sort of bragging about yourself, or are you more humble and reflective? So, you want to talk again about your own personal characteristics, those things that you think you do better than anyone else, even if it's just one thing that you have particularly excelled at, that your professors have commented on, that your letter writers have emphasized in their letters if they're open to discussing that with you. Those are the kinds of things that you can articulate, but be really careful, because you don't want to elevate yourself by putting others down. That is not professional, it's not mature, and it will reflect very badly on you. So, acknowledge the strengths of others rather than trying to negate them, and just focus on what you do best. Number 3, questions about your work experience, particularly in regard to your relationship with superiors. So an example would be, who was your best boss, who was your worst boss, and what qualities did they possess that made them the best or worst in your opinion. So, similar to comparing yourself to your peers, this question wants to see how you relate to your superiors and what you articulate as best and worst qualities or characteristics. So again, you want to be careful here. You want to be diplomatic and specific with your language. When you talk about your worst boss, that language in the question itself is sort of prompting something quite negative. However, you don't want to go super negative. You don't want to attack someone to be able to demonstrate what qualities you want to work against. So you could say something like, well, while I understand these particular procedures from that boss's perspective, and I understand why in this context those could be priorities, I had some other priorities that I thought needed to be advanced as well, and those were the following. Right, so there I've said, look, the position that this boss took, it was valid, I understand it contextually, but we just didn't have the same priorities. And then by discussing what those priorities are, you can then transition into talking about what qualities you think made your best boss the better boss, assuming that they upheld those things that you identify as ideals within yourself. At the very end of the interview, you are very likely to be asked whether you have any questions for the interviewer or the panel. And if you're not ready for this, it can really throw you off. This is meant to see what your own level of inquisitiveness is. It's also meant to see what knowledge of the school or program you already have. So, asking specific questions about the curriculum will demonstrate that you've actually looked into what's taking place. If you want to get some clarification about something that wasn't on the website or other materials, if you are new to the area and just want to, ask whether the campus tends to be more insulated or where students tend to go out, particularly residents in this case, and what's, some of the favorite places of residents to blow off some steam in the area. You could also ask more sort of, I don't want to say quirky, but just general type questions. One that we see a lot is asking the interviewer, one of the interviewers, what do you love most about your program here? Or what do you think is the most important development in this program over the past 5 years? Things like that are really useful. So come up with a few questions in advance of your interview, because you're very likely to be asked this, and you really don't want to say no when they ask you if you have any questions. That, of course, just demonstrates that you haven't looked in, or well, they might think that you haven't looked into things effectively, or that you lack that curiosity. Even if you have it, you're not able to display it if you say no. So don't say no. And then finally, policy type questions with regard to contentious or controversial issues can be tricky. So for example, what are your thoughts on the recent legalization of physician-assisted dying in Canada? This was something that was ruled on by the Supreme Court. If something made it to the Supreme Court, you know it's going to be contentious. And the fact that these are sort of hot button issues about which people feel very, very strongly one way or the other, you need to be careful with how you address it while still being able to defend your own perspective. So, keep an eye on the headlines for hot topics, know the ins and outs of some of the more common contentious issues in healthcare. Physician-assisted dying is a big one. Medicinal and or recreational cannabis is a big one. Alternative medicine, things like that. So, what you want to do is be able to show balance. Be able to acknowledge the validity of concerns of those on the other side, those with whom you disagree, or demonstrating what you prioritize differently. By framing your response in that way, acknowledging that validity, prioritizing or demonstrating what your own priorities are, you demonstrate maturity and professionalism. People on both sides of these arguments have reasons for their position, and they're often valid reasons. Sure, there are some invalid reasons, maybe, but we don't want to focus on that. We want to focus on the fact that there are valid concerns, regardless of which side you're on, and that we don't just want to brush off those concerns as inconsequential. We want to address them and demonstrate why we think our perspective addresses them more effectively. So, if I'm giving a model answer to this, I would start off by saying, yes, physician-assisted dying or physician-assisted suicide is a topic that has caused a lot of controversy around the world. It was made legal in Canada just a few years ago, but it remains a divisive issue both within the medical community and in the larger public sphere. Those who are opposed to physician-assisted dying often do so from the perspective of principle, which is to say that a physician has a duty to heal, not to harm, and death is the ultimate harm in that perspective. The physician may have personal convictions, values, or religious beliefs that need to be addressed in this context. They can't be forced to go against those. Those against would also say, well, we do have palliative care for people who are going to enter a period or who have entered a period of irreversible decline, and that will give them comfort until they pass on in terms of having a natural death. As well, medical advances can happen but when we aren't even necessarily looking for them, which is to say researchers are constantly working on things and taking next steps, and we can keep up with the literature and the scholarship, but still sometimes a breakthrough happens when it's least expected. So we don't want to make any hasty decisions. If someone commits physician-assisted dying and then 3 weeks later a unintentional or a surprise medical breakthrough takes place, well, then we would have been able to maybe address that so that they didn't have to take that particular route. And even if it's something that is, in development but might take 6 months or so, if we can estimate that that person has approximately 6 months left in them, we can give them that comfort-giving palliative care in case they do pass on, but we can try to get them into this new procedure or treatment as soon as possible. And lastly, there is a concern that when legalized, insurance companies could get involved in terms of putting undue pressure on physicians to avoid more expensive procedures. Now, that's more relevant in places with for-profit healthcare, but it's still something worth keeping sort of broadly in mind that this could be a possibility if even universal healthcare was ever privatized here in Canada. So those in support tend to say that, agree, yes, the duty of the physician is to heal, not to harm, but in this case, harm is considered as allowing such intense suffering to continue when there's no reasonable hope of curing that individual. They say also in principle that people have a right to die with dignity and in a humane way, and that patients have the right to choose the treatment that they want. It would also allow doctors who have already been sort of covertly practicing physician-assisted dying assistance without criminal charges. It would provide them the opportunity to continue doing what they see as helping without the threat of violating the law. And as long as we have strict standards and procedures and protocols in place that can ensure that only those with intense suffering who are in a state of reversible decline and who will die in a reasonably foreseeable amount of time, then we are, again, from this perspective, able to offer physician-assisted dying as an option, and one that addresses a lot of the ethical concerns of those who are opposed. So in terms of my own position, I absolutely understand the importance of the positions on both sides here, especially those on the basis of principle. That said, ultimately, the principle of patient autonomy requires us to give the patient the final decision in such matters, as long as they're able to give informed consent and that they meet those necessary standards and protocols for the procedure. We would need to ensure that we are staying up to date and following models and protocols that already exist to make sure those standards are maintained. We need to give sort of routine public education campaigns so that the public is thoroughly educated about what this actually means, what the criteria are, that this isn't something that's just taken lightly. And we need to give physicians the opportunity to opt out if this conflicts with their beliefs or convictions. We don't want to make people go against those beliefs. And again, on principle, those are valid concerns. And so addressing that by offering the opportunity to opt out is one way to resolve that particular issue. So there we go. I've gone through, gave both sides, continuously acknowledged the validity of both sides, and demonstrated what my position is and why I hold it. And you can do that with any of these controversial topics. So start thinking through where you fall in terms of those and construct your own policy questions and responses to them, because they can be really difficult, especially when you're put on the spot. The inclination is to just start with your own opinion. And again, that's not necessarily the most professional way to deal with it. Give both sides first and then demonstrate where you fall. So I hope that you've enjoyed this video and that it was helpful. If so, please do go ahead, like it, share it with a friend who might benefit from it. Be sure to subscribe to our channel on YouTube, follow us on Facebook, and look for us on a variety of other social media platforms. Feel free to comment with any questions you have. If you'd like us to help you with your residency prep or any other aspect of the admissions and application process, please click the link that should appear either above or below this video to see our programs and schedule a free initial consultation. We'll set you up with one of our admissions experts to answer any questions you might have and get you started on your preparations. We have programs to suit any of your needs, and we're happy to work with you to determine which plan will help you most effectively. As ever, thank you so very much for your time. Take good care, and I'll see you next time.